This recording will go over cryptorchidism, epispadias, and hypospadias. Cryptorchidism is at least one undescended testicle at birth. Premature infants have a greater risk. Most infants have spontaneous descent of their testes during the first 6 months of life. Testes that are not palpable or not easily guided into the scrotum, and a previously descended testis that ascends into an extrascrotal position are manifestations of cryptorchidism. When assessing for cryptorchidism, testes can retract into the inguinal canal if the infant is cold or upset. The cremasteric reflex testicular retraction in response to tactile stimulation to the front inner thigh can lead to a false diagnosis of cryptorchidism. When the child is being examined, we want to make sure that the environment is warm and that the child is calm before the examination. The provider should make sure they have warm hands before touching the infant. The provider will milk each testis downward from the groin and document its distal point. Positioning is important with the older child. They may be in a seated or frog-legged position. I've seen providers have the child sit on parent's legs with the parent's legs slightly spread so that the child's bottom dips down a little bit to help facilitate assessment. And it's important to note that most testes do descend by the time the infant is 6 months old. So it is very important that this gets recognized and treated, because without treatment, the child is at risk for sterility and testicular cancer, possibly testicular torsion in the future. Sperm production is decreased in undescended testes, and there is an increased risk for the development of a malignancy when the child reaches adulthood. Inguinal hernias are most commonly associated with cryptorchidism, as is testicular torsion. In terms of treatment, initially the infant with cryptorchidism is managed by observation because spontaneous descent of the testes during the first 6 months of life is very common. If the condition persists beyond 6 months of corrected gestational age, an orchidopexy is performed to bring the testes into the scrotal sac and suture into place. Surgical correction before 12 months of age can reduce the risk for adverse consequences such as altered fertility and malignancy. This surgery is typically done on an outpatient basis using a laparoscopic approach. Please review the purple nursing care box for the child with cryptorchidism on your own. Hypospadias is a congenital anomaly in which the actual opening of the urethromeatus is below the normal placement on the glands of the penis. The urethromeatus will have a ventral placement. The ventral placement being on the underside of the penis. It's important for testing purposes to make sure you understand the difference with the ventral and dorsal placement of the openings in order to understand questions that are being asked of you. The degree of misplacement of the urethral opening can vary. The urethra may open only slightly ventral to the glands or as far back as the penoscrotal junction. Chordee, or downward curvature of the penile shaft, is usually seen in more severe forms of hypospadias. Epispadias is dorsal placement of the urethral opening, or here at the upper, on top of the penis. Again, know the differences between dorsal and ventral for testing purposes. Hypospadias occurs from incomplete development of the urethra in utero. The displacement of the urethral meatus does not usually interfere with urinary continence. However, stenosis of the opening gives rise to partial obstruction of outflow urine. Further, ventral placement of the urethral opening might interfere with fertility if the mature man is left uncorrected. Ventral placement of urethral opening, altered urinary stream, and chordee are physical manifestations of hypospadias. Correction of hypospadias is accomplished by surgical intervention, which is usually done in one stage and on an outpatient basis. The surgeon releases the chordee, lengthens the urethra, positions the meatus at the penile tip, and reconstructs the penis. The surgical procedure should be done before the age of toilet training because the location of the meatus may make it difficult for the child to urinate standing up. Surgery is ideally done between the ages of 6 to 12 months of age. Infants with hypospadias, this is important, should not be circumcised because the foreskin can be used for surgical reconstruction.